we have to understand something that is crucial for us. There is a very important point when I put this, I would say this equation here, which is the hierarchy 1, which is the facial message. It is formed by what I see in the facial units and what I see in the facial subunits. So take a look. When I try to identify where I have to focus on to change the unfavorable facial messages, I have to identify piece by piece what is optimal, what is favorable, what is acceptable, and what is unfavorable. After we had this brief understanding of facial assessment, I will let you know about what patient wants. In my consultation, I usually ask the patient to look in the mirror and point 3 areas. And I would like to compare with you, because I also take photos, and I ask the patient to compare, right? They ask the 3 areas in the mirror and then 3 areas in the photo. So when she looked in the mirror, she told me, my number 1 is cheek, number 2, forehead lines, number 3, nasolabial fold. But when I presented this photo to her, okay, she assessed only this photo at rest. She told me, my number 1 area now is my lips. My second one, it was the eye corner. And my third one was the double chin. So interestingly, if we are trying to deliver an optimal result, I sometimes wonder if I only delivered her patient once, right, when she looked in the mirror, if I would be able to deliver an impactful, positive result to her. So when I asked her to assess her photos, as you may see here, she pointed out for me 6 areas that I have to coordinate and explain to her that I possibly have to approach all of them, right, in a sequence that I would make the most of her treatment. And what I think is so powerful during the consultation to use mirrors and photos is because it definitely broadens patients' perspective on treatment areas. I also experienced patients that they pointed in the mirror, okay, 3 areas, and when they looked in the photo, they continued to point in the same areas. And sometimes it's because the patient are so attracted for those areas that they don't want to see anything else. And that's why sometimes patients' requests are more emotional linked than concretely linked. So whenever they say, oh, I hate this line, okay, however, when I compare the problems of a prominent nasolabial fold versus the double chin, and the patient even doesn't mention the double chin, I see that there is this kind of emotional attachment to certain areas that not necessarily even being corrected will deliver patient satisfaction.